Here are your acute phase exercise, range of motion exercise at the lumbar spine. We're gonna start with the shotgun techniques with our Pilates ring. So you're gonna have both feet through the ring, cord tight, and then you're going to push out against the ring, give it a hold, push out against the ring, give it a hold, using your adductors for shotgun. So again, you're gonna squeeze here, and you wanna hold, you're gonna squeeze all the way in and hold, squeeze all the way in and hold. Okay. So those help with your pelvic alignment. Next one is your single and double knee to chest. For this, we're gonna use the physio ball to get it as a range of motion exercise. If you do this without, and you're just trying to do single knee to chest like this is more of a resistance type exercise. You can do it without the physio ball by just pulling one knee towards your chest, pulling two knees towards double knee towards your chest. Doing it a little bit more like a range of motion dosage. You can do it here. Again, you have one leg and you're just doing single knee. If double is too aggressive on the spine, or for whatever reason you can't use the other leg, and then double knee is typically what we'll do. Next is forward flexion, seated in the chair. So you're gonna do this a couple ways. Going forward, coming back. To get a lumbar flexion, you wanna make sure they're going into that lumbar flexion if that's what you're doing it for. They can do it as a hip hinge, keep their back flat, and do it as a lat stretch. Here we're doing it for the flexion, so you wanna roll into it. They're gonna come, and then your other way is gonna be with a little side bend / rotation here. So that's your lumbar flexion. Sit in the chair with a physio ball. Next is LTRs, lower trunk rotations. So you can do them without the ball, just on the table like so. And then they're going to rotate. We can use the uppers to kind of get a little bit more of a rotation each way. And then we're gonna add the ball to get a little bit more. Most of the times I have acute patients to hold on to the table if they're doing it on the table with this one. Coming back side to side for your lower trunk rotations. Prone press up is a progression to your prone press up. Prone press up is going to start initially just prone lying, prone on elbows. Prone on elbows is just laying with your elbows underneath your body. Propped on elbows, a little bit higher. Prone on elbows, press up on elbows, prone press up on elbows, and then your actual prone press up here, where you can grade it going all the way up, keeping the thighs on the mat. You can do it for hold time, or you can do it for repetitions, repeated motions. Also get lumbar extension. You can do this against the wall for whatever reason they're not able to get prone. Kind of like a push-up position. You just need a little wall space. They're gonna press their pelvis towards the wall, just like we did over there, where they're trying to get some good lumbar extension. Some patients don't really understand what they're supposed to do, so I have them do kind of like push up with it if they're not really able to understand the motions. Do it with a push up. Pelvic clock. Pelvic clock, you're gonna do, you're gonna initiate here starting in supine. And you wanna get all directions of the pelvis, just like a clock. So you can do it in supine, you can do it hook lying, right? So they're just gonna kind of tilt their pelvis as a side bend, as a rotation, as a flexion. So up will be 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, and such. Trying to move their pelvis in that position, gets a little range of motion on their lumbar spine and gets their pelvis moving. And last one here is the cat camel. This one is in quadruped. you're gonna go into the camel, down to the cat. There's the overall motion, and then you want to try to get them to isolate the motions. Get it from just their pelvis, lumbar spine, thoracic spine, cervical spine, thoracic spine, lumbar spine extension, and then a anterior tilt. So you're gonna posterior tilt, lumbar flexion, thoracic flexion, cervical flexion, cervical extension, thoracic extension, lumbar extension, anterior pelvic tilt. So there's your cat and your camel. You want them to do it as a gross motion and as a individual motion, trying to use their transverse abdominis for that contraction.